Hi, welcome to Bloodborne Pathogens for Schools. My name is Tanya Reed. I am a health educator with District 3 of the Oklahoma State Department of Health. As sure as children fall while learning to walk, students will experience cuts, bruises, and other injuries. In times past, little thought was given to the treatment of such injuries. However, in today's environment, it's critical that school professionals plan a safe response to children in need. Whether you're in the classroom, playing on the field, or on a school bus, all school employees must know the potential danger of bloodborne pathogens. Guidelines have been developed by the Centers of Disease Control and the Occupational Safety and Health Administration that can protect you from bloodborne pathogens. These guidelines outline a method for you and your school system to follow in order to substantially reduce the risk of contracting a bloodborne disease while on the job. OSHA has developed a standard to protect anyone who can reasonably anticipate contact with blood or potentially infectious bodily fluids while at work. OSHA recommends that school systems identify the personnel whose job duties expose them to blood and potentially infectious bodily fluids. Not every school employee is occupationally exposed to bloodborne pathogens. However, it's important that every school employee understands the dangers of infection and safe practices to minimize the risk. Bloodborne pathogens are microorganisms carried by human blood and other bodily fluids that can cause disease in humans. So how do pathogens enter the body? Bloodborne pathogens can cause infection by entering your body through open cuts, scrapes, acne, skin abrasion, or mucous membranes. They can also be transmitted when you touch a contaminated object or surface and transfer the infection by touching your mouth, eyes, or nose. Here's an example you will see at school. A student named James scuffed his knee and there is blood. So what do you need to know to protect yourself and your other students from bloodborne pathogens? First, we will talk about exposure. In the school setting, potential exposure with bloodborne pathogens most often occurs from direct contact with bodily fluids from the nose, mouth, and eyes that contain blood, bleeding wounds that are caused by a cut, punctured, or abraded skin, bleeding skin conditions such as acne or athlete's foot, human bites by students, and chronic sudden onset diarrhea or vomit that is contaminated with blood. Special education employees should take extra caution while working with severely disabled children. Some children may be more vulnerable to injury, likely to have special medical needs, or dependent on adults for their personal care. Unfortunately, children are as prone to bloodborne diseases as adults are. That means that you are in just as much danger of infection from children you work with as any other group in society. 3 of the most common illnesses that we will discuss are Hep B, referred to as HBV, Hepatitis C, referred to as HCV, and AIDS, acquired immunodeficiency syndrome. Some other common illnesses can be West Nile virus, malaria, syphilis, and MARS. Hepatitis means inflammation of the liver. Most people suffering from HBV will heal in approximately 6 months, but the virus can be life-threatening, leading to cirrhosis and almost certain death. The interesting thing about HBV is it can survive on surfaces dried at a room temperature for at least a week. Contaminated surfaces are a major factor in the spread of HBV. It's always important to treat blood, wet or dry, as infectious. If you become infected with HBV, you may suffer from flu-like symptoms: fatigue, weight loss, fever, diarrhea, loss of appetite, joint pain. You may require a hospitalization, or you may not experience any symptoms, being unaware that you're a carrier. Your blood, saliva, and other bodily fluids may become infected. You may spread the virus to sexual partners, family members, and even unborn infants. Only about 30 to 50% of individuals show symptoms. there is a vaccine for HBV. Employers are to provide at-risk employees with the opportunity within 10 days of assignment. If the employee chooses not to receive the vaccine, they must sign a form. The HPV vaccine is highly effective with few after effects, and it's completed in a series of 3 shots over a 6-month period. It's important to complete the series according to the recommendations if you choose to receive the vaccine. Hepatitis C is a liver infection caused by the HCV virus. Approximately 4 million Americans are currently infected with HCV, and an estimated 36,000 to 242,000 new infections will occur in the U.S. each year. About 15% of the HCV-infected individuals clear the virus. About 85% go on to develop chronic Hep C infection. Chronic liver disease may develop in 70% of the individuals with chronic Hep C, resulting in about 8,000 to 10,000 deaths each year. Infection with HCV is the most common reason people have liver transplants in the United States. It's important to remember that 70 to 80% of those with acute Hep C don't even have any symptoms. There is no vaccine, and the only way to know if you have it is to get tested. Hepatitis C is spread by direct contact with blood of an infected person. Once transmitted, the incubation period is an average of 45 to 75 days. Only about 25 to 30% of infected individuals show any signs of infection, and those signs may not be recognized. Symptoms of HCV are similar to those of HBV, including fever, fatigue, loss of appetite, nausea, vomiting, or abdominal pain. Another bloodborne pathogen disease can be human immunodeficiency virus, otherwise known as HIV. This is the virus responsible for causing AIDS, which stands for Acquired Immunodeficiency Syndrome. The virus attacks the body's immune system and targets the cells that are needed to fight the infection from pathogens. At present times, there's no vaccine to prevent AIDS, however, it can be treatable with medicine. Symptoms of HIV can include flu-like symptoms, enlarged lymph nodes, fatigue, frequent fevers, weight loss, persistent or frequent skin rashes. However, you can't rely on symptoms alone to tell if you have HIV. The only way to know for sure is to get tested. You may carry the virus without showing symptoms for several years. A possible outcome is falling victim to AIDS-related illnesses, which can include neurological problems, cancer, and other infections. HIV is transmitted mainly through sexual contact, but can also be spread by contact with blood or other bodily fluids. HIV is not transmitted by touching or working around people who carry the disease. It's also important to know that it is not spread by air or water, insects including mosquitoes. It is not spread by saliva, tears, or sweat, by casual contact like shaking hands, or by drinking fountains. Because risks for exposure to bloodborne pathogens do exist, it's important to always be prepared to respond using universal precautions. Most approaches to infection control are based upon the concept of universal precaution, which means treating all blood and bodily fluids as if they were potentially infectious. This approach is critical because it's impossible to tell who is infected with HBV, HCV, or HIV simply by appearances. Many people who carry infectious disease have no visible symptoms and no knowledge of their condition. Victims of HBV, HCV, and HIV can come from all age groups, every social economic class, every state and territory, and even rural areas to inner cities. Remember that an exposure can lead to an infection. Using universal precautions may literally save your life. And now back to James, the student that fell and scuffed his knee. Now that you've learned about universal precautions around bloodborne pathogens, you now know to grab a pair of gloves and use something as a barrier between your skin and James while you're treating his wound. This will help to protect you and protect him. As you're taking care of James, you also need to remember to always use universal precautions. This means treating all human blood and bodily fluids as if they're infectious. This should be used in all situations where there is potential for contact with blood or potentially infectious materials at all times. OSHA recommends that every school system create a written exposure control plan, otherwise known as ECP, that's made available to every school employee. The ECP will identify personnel at the greatest risk for exposure. It will analyze potential hazards for each job description, determine what measures will be taken to reduce the risk of exposure to bloodborne pathogens on the job. This should be reviewed every year, and it is OSHA'S bloodborne pathogen standard. Reducing your risk of exposure to bloodborne pathogens means you need to do more than wear gloves. To protect yourself effectively, always use universal precautions, workplace controls, personal protective equipment, engineering controls, housekeeping such as cleaning, and access to the hepatitis B vaccination. Though none of these approaches can be 100% effective, they all must be used together to protect you and others from bloodborne pathogens. Engineering controls are physical or mechanical systems used to eliminate hazards at their source and prevent staff exposures. Their effectiveness normally depends on the staff person using them. Know what engineering controls are available at your school and how to use them properly. For example, appropriate containers may be used for disposing of regulated waste and towels soaked in blood or bodily fluids. Workplace controls are specific procedures you must follow on the job to reduce your exposure to blood or other potentially infectious materials. Some school systems will assign specific personnel to deal with bloodborne hazards on a regular basis. These employees may include a trained person in bloodborne pathogen safety to give first aid treatment to students, or a custodian or trained person responsible for cleaning up body fluid spills. It is always important to remember proper and timely hand washing anytime you're in contact with any bodily fluids or after using gloves. The most important workplace control is hand washing. Good hand washing keeps you from transferring contamination from your hands to other parts of your body or to other surfaces you may come in contact with later. You should wash your hands with non-abrasive soap and running water every time you remove gloves or other PPE. If skin or mucous membranes come in direct contact with blood or other bodily fluids, wash or flush the area with water as soon as possible. Where hand washing facilities are not available, such as on a school bus, your employer will provide antiseptic hand cleanser or towelettes, and these can be used as a temporary measure only. You must still wash your hands with soap and running water as soon as you can. You must use appropriate personal protective equipment or PPE each time you perform a task with potentially infectious materials. The equipment must be appropriate for the task and fit properly, especially gloves. All equipment must be free of flaws that could impede safety. If PPE becomes penetrated by blood or other infectious materials, then remove it as soon as possible. The type of PPE appropriate for your job varies with the task and the exposure you anticipate. PPE that may be worn includes gloves, masks, aprons, lab coats, face shields, protective eyewear, masks, mouthpieces, resuscitation bags, and other ventilation devices. Gloves are the most frequently used type of personal protective equipment. You must wear gloves when it is reasonably anticipated that your hands may come in contact with blood, potentially infectious materials, mucous membranes, or non-intact skin. Single-use disposable gloves are used for first aid procedures. Heavy-duty utility gloves should be used for housekeeping. If you are allergic to disposable gloves, There are hypoallergenic gloves, glove liners, powderless gloves, and other alternatives available. Since gloves can be torn or punctured, if you have any cuts on your hands, cover them with bandages before putting on gloves. Replace gloves as soon as you can if they become torn, punctured, or contaminated, or otherwise defective in any way. Never wash or decontaminate single-use disposable gloves for reuse. As important as wearing gloves is, you are not protected unless you remove them correctly. Your school may provide emergency kits as an effective way to deal with injuries and reduce the threat of bloodborne pathogens. The kit should include gloves, gauze, band-aids, paper towels, antiseptic towelettes, Ziploc bag, and pocket mask. A pocket mask is a respiratory device designed to isolate you from contact with a victim's saliva. Avoid unprotected mouth-to-mouth resuscitation. Students or coworkers may expel saliva, blood, or other fluids during resuscitation. Good housekeeping is everyone's responsibility since it protects you and the students. Your school's exposure control plan will list specific methods and regular schedules for cleaning surfaces possibly contaminated with infectious materials. Here is an example of housekeeping that could occur in a school when a student or staff member is injured. Isolating the area until decontamination is completed to minimize exposure to others. Immediately clean and disinfect any visible surface contamination from blood or other bodily fluids. Cover the spills with absorbent material such as paper towels. Use EPA-approved disinfectant or bleach to saturate the area and allow it to soak for at least 30 minutes. After disinfecting and removing the material, clean and decontaminate the surface with disinfectant. It's important to remember adequate ventilation when workers are using with disinfectants. And remember, HBV can survive outside of the body and remains infectious for at least 7 days. Remember to always treat blood, whether it's wet or dry, as infectious. Clean and decontaminate all equipment and environmental working surfaces as soon as possible after contact with blood or other potentially infectious materials. This can include after completion of procedures, when surfaces are contaminated, and also at the end of the school day. Place contaminated sharps and infectious waste in designated containers. Sharps containers should be labeled or color-coded, leak-proof containers that are closable and easily accessible to those who need them. Do not allow waste containers to overfill. If handling contaminated laundry, handle it as little as possible. Place the soiled laundry in labeled or color-coded leak-proof bags or containers without sorting or rinsing. Bins, pails, cans, or other similar receptacles that are used and have a reasonable likelihood for being contaminated with blood or other infectious materials should be inspected and decontaminated on a regular basis. Watch for fluorescent orange or red labels, red bags, or containers with a biohazard symbol. This symbol warns you that the container holds blood or other potentially infectious materials. Labels should be placed on containers of regulated waste. This may be refrigerators or freezers containing blood or other potentially infectious materials, or other containers that are used to store, transport, or ship blood or other materials. Your school may be required to keep a Sharps injury log. These must be maintained to record the injuries from contaminated objects. It must be maintained in a way that ensures employee privacy, but must also include the description and location of the accident when these occur. So what happens if you are exposed at the school? So your treatment should begin as soon as possible after exposure. Flush contaminated material from the eyes, nose, and mouth with running water. Wash the exposed area with soap and water, vigorously scrubbing all areas. Notify your supervisor, seek appropriate care, clean and disinfect the accident area, and properly dispose of regulated waste. Accidents do happen. If you are exposed, immediately report the incident to your supervisor. Report how, when, where, and who was involved. Determine the document and the source of blood. Describe the events in as much detail as possible, and report potential bloodborne exposures to the principal. If you consent, your employer should provide you with a confidential medical evaluation, blood tests, post-exposure preventative treatment if available, and possible follow-up counseling. All staff at the school should know where the first aid kits are located and how to report incidents involving exposure. All school staff has responsibilities around bloodborne pathogens. You must participate in bloodborne pathogen training annually. You must be aware of the procedures outlined in your building's bloodborne pathogen exposure control plan. Know where PPE supplies are kept. Know how to protect yourself and all students in the building from potential bloodborne pathogen exposure. Remember to practice universal precaution and hand hygiene. Helping students to practice universal precautions and hand hygiene, reporting potential bloodborne pathogen exposure to the principal or designated contact, and requesting a hepatitis B vaccination if potential exposure to bloodborne pathogens has occurred. Attending bloodborne pathogen training is an OSHA training requirement. This must be provided to employees during working hours. It must be provided annually and at time of initial assignment, and there's additional training when assigned new or modified tasks which could affect a person's exposure level. It is important to review your site-specific exposure control plan. Your bloodborne pathogen training should include a copy of the OSHA standard, modes of transmission for bloodborne pathogens, how to recognize hazards in the workplace, use of engineering controls, work practices, and PPE, and the option of question and answer sessions if you were to have questions. Employers must maintain training records for 3 years from the training date and include the dates of training sessions, summary of the sessions, name and qualifications of the trainer, and name and job titles of those attending the sessions. Here are a few key things to remember from this training. Treat all blood and bodily fluids as if they are infectious. When providing first aid or CPR, protect yourself first, then treat the victim. Wear the appropriate PPE as determined by the accident. Contain spills immediately, then clean up and disinfect the area. Use tongs or a brush and dustpan to sweep up contaminated broken glass. Never use your hands, even if you're wearing gloves. Handle all trash as though it contains sharps or infectious items. After removing PPE, wash your hands with soap and water for at least 20 seconds. Rub hands together vigorously to remove potentially infectious contamination. As a school employee, you must react to an emergency not only with your heart, but also with your head. Know the facts about bloodborne diseases so you can take sensible precautions. Students, coworkers, and loved ones are counting on you. Take the time to protect yourself while helping a child or a coworker in need.